You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
Overwhelming majority of patients that I see for relief of migraine headaches have already explored everything, including all the available migraine medications, injections, acupuncture, and even some minimally invasive techniques like radiofrequency treatment of the nerves, nerve blocks, and Botox. And many of those obviously give some relief, but none is going to give the patients relief that they are looking for, hopefully for a lifetime, at least for a long time. And surgery becomes a really good choice for them because it does provide lasting and reliable relief. And most of the times, it is a complete relief. Now, in some patients, I may get 65, 75, 80%, 90% improvement in the first operation, but with additional tweaking and smaller procedures, we get them complete elimination. In fact, in every patient, my end goal is to have complete elimination of migraine headaches. And I can tell you that there are some patients that actually come to my office, sitting there smiling and very happy. And I ask them, how are the headaches? I say, you don't understand, you've changed my life. And are they gone completely? No, 75%, 80%, 90% are gone, but not completely. And I'm looking serious as thinking, actually, why is that it is not 100%? I'm asking them questions. And they look at me sort of like, are you silly? I'm very happy, actually, with what the improvement that I already have achieved. But I tell them, what, I don't get thrilled until you tell me that your headaches are gone completely. So I look for it and I find it. I usually find a way to take the headaches away completely. And that is when I become satisfied. And again, with the second and sometimes with the third operation, but subsequent smaller minor procedures, we can give even the patients who have multiple trigger sites, complete elimination of headaches. So that's what I call relief. That's what really makes me very gratified with what I'm doing for that particular patient. Many of the patients who see me, actually, this is not an exaggerated statement. Many tell me that if you're my last resort, and if you cannot help me, I don't want to live because I don't have a quality of life. And that doesn't apply to obviously every patient. And they're not suicidal psychologically. They're suicidal logically because they don't have quality of life. And when the surgery works for them, they are extremely happy. I have had many, many students that they actually could not go to college, could not follow education because of migraine headaches. And the unfortunate part of many of the migraine medications is that they reduce the cognitive function. Essentially, what the medications are doing, dulling the brain, so the pain is not felt. And the education is not fun for them because they cannot really comprehend the way they used to before the migraine or in between migraine. But the migraine headaches are so frequent for them that they can't participate in the classes, and often they have to leave in the middle of class. So those are the patients that after the surgery, and I have many of them, they have been able to go back to school and finish, get their degrees and start families. So I, over the last almost 25 years that I've been doing this, I have had many, many stories like this. So overwhelming majority of our patients that are seeing me, they don't have any quality of life. I have operated on patients as young as 12 or 13, and I've also operated on patients who were in the late 80s. And for any age group, when there's no quality of life, or the quality of life is so disturbed that they can't enjoy their life anymore, again, surgery is an option, and it helps them tremendously. So, and we've done studies in adolescent patients to see if it works as well as it does in adult patients, and demonstrated that the success rate is pretty much equal for both groups.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.